If you look at the United States, the doctor-patient ratio is about 1 doctor for every 390 people. But if you look at a country like Uganda, my home country, the doctor-patient ratio is 1 doctor for every 24,000 people. I see myself in these people all the time because at one point I was them. I was raised by a deaf-mute grandmother. My father and mother both died of HIV and AIDS. And my brother died of malaria before his 5th birthday. I got an opportunity through one of those send an orphan to school programs. You've seen a lot of programs around the world where you send a couple dollars across the globe to help an orphan. They go to school and for you on the other side, you hope their life is somehow better. And for me, the program that supported me offered a little more than just sending me to a local school. They said, we'll send you to college. Being born in the rural parts of Uganda and raised there and seeing the devastating effects of not having healthcare access, there was no better place for me to apply my engineering talent and help individuals access quality healthcare. We are a nonprofit organization that recruits newly graduated doctors, nurses, and midwives and places them to work in underserved regions. It all started with the problem of brain drain of healthcare professionals on the African continent. What we've learned is no one wants to leave their food, their culture, their language, their family to go work elsewhere if they can find a job with the same conditions locally. And if you look at the global health systems, they spend a lot of time and money and resources sending medical volunteers to go work in developing countries on short-term missions, and they have good intentions. But if we could spend a small amount of that money and those resources and empower the locally trained professionals to serve their own communities in their own countries, we could have an exponential impact. I grew up in that environment. I know what it means not to have. I wore my first pair of shoes when I was in my late teens. Being in the position that I'm in now of privilege to come back and help, there's no better place to be for me. My name is Christopher Ategeka, and this is my brief but spectacular take on providing healthcare access for all.